Dr. Joyce Locke, Medical Officer of Health, on the line to deliver her weekly media briefing. Please remain muted during the briefing until you're called upon to ask a question, and we will have time for 2 questions today. So over to you, Dr. Locke.
Thanks, Carla, and good afternoon, everybody. I'll start today's media briefing with a look at our most recent data. Today, we have 11 new cases, and this brings our active cases to 126. Variants of concern are making up 73% of our active cases. 2 cases were confirmed today to be of the lineage P1, which is the Brazilian variant of the 501Y mutation. These cases are now closed. Crescent Care Nursing Home in Woodstock is in outbreak. To date, there are 3 resident cases and 5 staff cases. 12 people are hospitalized and 4 are in the intensive care unit. As an aside, I do want to apologize that last week I stated that 10 was our highest number of hospitalizations to date. That was not accurate. We have had up to 16 cases in the past, but these double-digit numbers are uncommon for us. On the prevention front, nearly 70,000 residents of the Southwestern Public Health Region have now received at least 1 dose of vaccine, and this is 32% of the total population. So regarding vaccine, the province made some significant announcements last week regarding eligibility for the COVID-19 vaccine. To recap, on Friday, those 55 and over become eligible. Last Monday, all residents 18 plus in the province's hotspots became eligible in our region. That means residents of the N5H postal code. And tomorrow, as of 8 a.m., anyone 50 and over will become eligible to get vaccine through one of our public health clinics. As of tomorrow, also, Group 1 of essential workers who are not able to work from home will become eligible. Those who qualify as essential workers will be provided with a username and a password by their employers. This information is being sent out to the employers who have registered, and they will be getting this information this afternoon. Although eligibility is opening, and there are reports of increased shipments of vaccine, so our supply will be better. These larger shipments of vaccine have not yet made their way to us yet. So this will require some patience by everybody over the next couple of weeks, as demand for vaccine and appointments will be much higher than our supply. As supply increases, we will make more appointments available. On behalf of our mass immunization clinics, I do have a request. If you need to cancel your appointment for any reason, please cancel by calling the booking center or clicking on the link in your email confirmation. Someone else wants your appointment. If you cancel, rather than just failing to show up, we can fill that appointment with someone else who wants it. AstraZeneca and the Johnson & Johnson vaccine have been in the news again lately. Ontario continues to recommend that you accept the first vaccine you are eligible for. All the vaccines prevent serious illness, hospitalization, and death, and all are less risky than COVID is itself. That concludes my prepared remarks. I now hand this media conference back over to Carla.
Thank you, Dr. Locke. We will now open it up for questions. Today, starting with Shane Ketnes from Rogers.
Hi, Dr. Luck. How are you?
Hi, Shane.
Happy Mental Health Week. I'm just wondering, do you have any tips what you and your staff do to keep it cool during these crazy times?
Thanks for that question, Shane. Keeping ourselves mentally well as physically well through this past year has been as an important priority as managing the COVID outbreak for the community. It's been a tough year, and so we have not been able to take it for granted that our mental health will just stay well. So yes, it is a daily effort where every single staff person from the top down thinks of not only what do we need to do to manage the outbreak, but what do we need to do to keep ourselves mentally healthy. And that requires ongoing attention to this important aspect. So it sometimes has to do with just plain self-talk, that this too will end and we will get through it. It requires celebrating all of our successes when we get more vaccine into arms, when we start to see the epi curve come down, when we begin to open up our society after each of our lockdowns and we can share with everyone the excitement of going out. So I encourage everyone out there to try and look at the glass half full, to look for those things that are uplifting and to continue to support one another. We're all in this together. It is a tough time, but we can do it together.
Thank you for those words. That's all today. Thanks.
Thank you, Shane. Moving on to Matthew Trevovic from 980. We didn't hear you there, Matthew. Did you want to try again? We can circle back. We'll go to Chris McMillan from Heart FM.
Thanks for taking my question. Dr. Locke, the case numbers in our region, Southwestern Public Health, have been on a steady decline. What do you attribute to that?
I think there's several factors at play, Chris. So one, vaccines are the number of people going up, the number of people who are receiving vaccine are going up and up and up. And so we've got quite a chunk of our population, somewhere over 30, somewhere between 30 and 35% are already vaccinated with at least one dose. And so we are definitely see the impact of that with fewer cases in our seniors who have been the first ones to get the vaccine. And we hope to see that trend continue as more and more younger people get the vaccine as well. The other thing is that although case rates continue to be high in some of our neighboring health units, their case rates are coming down as well. And so the trickle over effect of cases spreading from other parts of the province to locally have also decreased. I think the stay-at-home order, as much as it is frustrating to all of us, it is having its impact. The epi curve started to turn on the downward slant not long after the stay-at-home order did come into place. So we appreciate and thank our community citizens for doing their part in abiding by the stay-at-home order, and we can attribute these falling cases to that as well. So all of those factors are having a role here, and we do very much expect and hope that the rates will continue down.
Follow up, if I may. Dr. Luck, we found out today that Pfizer is now being approved for children between the ages of 12 to 15, the Pfizer vaccine, that is, that it's tested really well. Obviously, you're following this. What are your thoughts on that? And what are your thoughts on the potential of kids maybe getting vaccines in the not so distant future?
I think it's absolutely great news. It was expected that this would happen. There was no reason for the vaccine not to be suitable in this younger age bracket, but we did need to wait for the research to be done before we could be sure. And so I think we're at that point now. I expect that the province is now taking this into consideration as it plans out the future rollout of the vaccine program within our province. We're quite excited that we're beginning to see that by the end of this month, we're hopefully going to be moving down rapidly in age brackets. So perhaps by the end of the month, we'll be doing everybody over the age of 18. And then I suspect that not long thereafter, the province will start to aim for that younger age cohort as well and include those in the vaccine rollout.
Thank you, Chris. Moving on to Rob Perry, Elmer Express.
Thanks very much. Hi, Dr. Locke. I just to start, I'd like to check with you. You mentioned the two resolved cases related to the the variant first identified in Brazil. I wonder if you could give us some idea of was that a case of travel or meeting somebody who traveled from overseas in terms of how it was contracted. Yeah. Obviously, it'd be more of a concern if it was a community transmission than, say, I met with somebody who just returned from South America.
My understanding is that the cases showed up in one of our long-term care homes. There wasn't a direct connection to travel, which does again speak to the fact that these variants are circulating within the community. We have community transmission of these variants. They were introduced into Canada from other parts of the world, but now they have their foothold within Ontario, and locally we are seeing 70% of our cases as being variants of concern. And so I think people need to be aware that it doesn't require travel to get this, that anybody, anywhere, at any time in our community can be exposed and get the variants of concern. So once again, the need to adhere to those ongoing measures of physical distancing, wearing your mask, hand washing, and staying within your bubble until we all get the vaccine into us.
And you also mentioned the need for people to call in about cancellations. Do you have any estimate in what sort of rate you're seeing? Is it like 1% of appointments aren't being filled, or 5%, or 10%?
I don't actually have the rate. My staff could probably find that, but I don't have that at my fingertips. I can say that we do get regular cancellations every single day, or people who just fail to show. And it's we have a system in place, we're working at enhancing it to ensure that we have a list of individuals who we can call at the first notice of a cancellation, so we fill those empty spots. We don't want to see a single dose of vaccine go to waste. When we have a cancellation, that gives us a little bit of lead time, and we can find someone to fill your spot. So it's not a problem of canceling, but we cannot fill that spot quick and easily if you fail to show. Then we're scrambling to fill your spot. So please, if you can't make your appointment for any reason at all, don't feel bad about it, but do call us as soon as you can to let us know so we can ensure that your spot is filled and we don't waste a single dose of vaccine.
Thank you, Doctor.
Thank you, Rob. Now on to Ian McCallum from MyFM.
Hello, Dr. Locke. Can you hear me all right?
I can hear you, Ian. Thank you.
Okay, great. Thank you. Maybe a quick explanation here, Dr. Locke. I understand there may be several, just a handful of variants that may have come in from India. They're being classified as variants of interest. Then we have variants of concern. Is there a quick thumbnail sketch of what the difference is between those two definitions?
Yes, a variant of concern is one that we know has an impact to transmissibility or the nature of the disease, the severity of the disease. Then they become concerning to us. Variants of interest are variants that show up, but we aren't yet sure that they are worse than the variants we already have around in terms of their impact to spread and make people sick. So at this point in time, we just keep an eye on them and we call them variants of interest.
Good. I appreciate that. That's a good, quick differentiation there on that. A follow-up question. With the increase in vaccinations now being available, made available through the month of May, is there any thought, is it possible that people's second shots could possibly be moved up from the 120-day time frame, and how would that be conveyed to the public?
So the first objective of the province is to get as many first doses into people's arms as possible. So to get as many people vaccinated with at least one dose. So we've hit a good chunk of our population, as I said, somewhere around 35%, but so we still have a good chunk to go. Vaccine supply is increasing. We have a line of sight to it towards the end of the month. So it will depend completely on vaccine supply. If we can get down to be sure that we got everybody who's eligible covered with at least one dose, then we can start moving ahead to close that interval or shorten that interval for the second dose. We don't have a line of sight on that yet because we actually don't have that long distance sight on our vaccine supply. Once we know more what we're going to have in hands until at the end of June, then we can see how far we are coming with getting everybody with at least their first dose. We're ahead of schedule now, so that has us all very excited. Let's hope we can continue on that route of staying ahead of schedule. And then maybe if there's enough vaccine, we could possibly shorten the interval. We do know that come July, all those second doses are due. So there's going to be in July, everybody who needs their second dose plus everybody who needs their first dose. So we're going to need even more vaccine to get that all covered. So lots of issues to consider before we can shorten the dose.
Great. Thank you, Dr. Locke.
Thanks, Ian. Moving on to Chris Abbott from the Tillsonburg News.
Hi, Dr. Locke. Can you hear me?
I can hear you, Chris.
Excellent. On Saturday, there are some people planning to rally from Tillsonburg to Norwich in the form of a parade and then meet in Norwich for some speeches and stuff like that. What kind of impact do these rallies and gatherings have on the spread of COVID?
Well, first of all, that breaches the gathering limits and the stay-at-home order. So we do very much encourage our citizens not to participate. We at Public Health always have significant concerns when people congregate. I must say that now that we have 70% of our cases are coming back as a variant of concern, having these crowds gather in this kind of way is an issue of concern. And so we encourage people not to participate. There are other ways to express your opinion and to show that you may disagree with the province on the way its policies are going. We suggest that we encourage people with dissenting opinions to use other venues, but avoid using methodologies that require people to gather together within and breaching the physical distance requirements.
Okay. And this group that's organizing it may or may not be part of the No More Lockdowns group. Is the end of lockout, or at least going back to a colored system regionally, is that coming up in the next couple of weeks, do you think, or are we still a long ways away from that?
Provincially, we have turned the curve since the lockdown came into place. The daily incident rates have been falling. In our region, we are coming down nicely. There are the hotspots in Ontario where the daily incident rates are still above the peaks that they had in wave 2. So the daily incident rates continue to be high in some of these hotspot areas. Fortunately, the province is providing extra attention to these regions through enhanced vaccine programs, and we hope to begin to see those impacts in the coming weeks. So if the combined efforts of the lockdown plus the enhanced vaccine rollout in these hotspots start to pay off, we expect to see and hope to see the incident rates, the daily incident rates continue to go down. And that would bode for good news in terms of opening up the province. That said, although the rate of new admissions to ICU and hospital have been flattening out, they still are substantive in their numbers, and our province continues to struggle with adequate resources within the hospitals and the ICUs to manage these patients. So we'll have to watch how that goes as well.
Okay, thank you very much.
Thanks, Chris. And last, we have Kathleen Sailors from the Woodstock Sentinel.
Hi there, Dr. Locke. Thank you for taking my question. Can you hear me all right?
I can, Kathleen.
Wonderful, thank you. With news today that eligibility is further expanded in the Southwestern Public Health region, I was wondering about the capacity of our vaccination clinics, the 3 mass immunization clinics. Are they running at capacity in terms of the number of people that they can immunize per day, or is there still room to expand that further? Or if they are at capacity, is there plans to expand that even further?
So we still have spots at our St. Thomas clinic this week. So even as soon as tomorrow, there are some spots available. The vaccine supply is a little bit tighter this week and next week relative to the last part of May, when our vaccine supply will increase. So we are not yet functioning at max. We do have open spots, and we will be opening more spots in the coming weeks. That said, even with the new opening spots and the increased vaccine supply that is expected in the latter part of May, there are so many individuals that are now eligible in the cohort that is being opened up as of tomorrow, that people will be able to get an appointment, but they may need to wait a number of weeks before they actually are there for the date of their appointment. And if you don't happen to get an appointment, then just stay tuned. Every Monday we will be opening up a new chunk of appointments. So I think it's a matter of just, again, a little bit of patience is required. We do have more vaccine coming. We are going to be running our mass immunization centers at full blast, but there's still lots of people who want to get those shots in arms. So patience all around.
Wonderful. That's it for my questions. Thank you.
Thanks, Kathleen. And I see Matthew. Do you want to give it a try again?
Yes, I can hear me okay.
Yes, Matthew.
Hi, sorry about the technical issues there, Dr. Locke. I just had a question about vaccine uptake, particularly in the N5H hotspot now that we've seen sort of lower age eligibility and the province sending more vaccine doses to hotspots. And I'm curious just because the recent data, or the most recent data from ICES, had N5H as being among the lowest in the province when it came to people being vaccinated. I think it was just under 18% of people had at least one dose as of April 25th. When looking at all age groups, whereas N5L, which is around Port Stanley, had about 43%, which is among the highest in Ontario. Is the health unit finding vaccine hesitancy to be an issue in N5H, and are you expecting things to improve there once eligibility expands in hotspots to people 18 and over?
We every time we have a new option for individuals in that postal code to get vaccine, we have been finding that we have had no trouble filling it. So we are having a special clinic through the East Elgin Family Health Team. That's full up. We do notice that every time we drop the age bracket, appointments start to fill up pretty quickly, including from that region. I suspect that there is some degree of vaccine hesitancy among some members of that postal code. What the ultimate outcome will be as to how many will be vaccine hesitant, that's not clear yet. Right now, it's a little difficult to know whether this is an issue of vaccine access or an issue of vaccine hesitancy. That said, we are working with healthcare providers and some other community groups within that postal code to find fresh ways and to reach out to members of that community to ensure that they have what they need to make an informed decision about receipt of vaccine.
Thank you. That's all my questions.
Thank you, Matthew, and thank you, Dr. Locke. That concludes today's media brief. If you do have further